Good morning, Dr. Reddy.
Good morning.
Welcome to the Business Standard Budget Show. Thank you for taking out time. I was just wondering that obviously after the pandemic, the healthcare budget has assumed a lot of significance, but the 2023 budget is likely to be, I think, the first one after a post-pandemic period, if we can call that. So, what kind of policy level changes do you think are required at the central and the state levels as well? So, after the pandemic is now ebbing and we need to focus on other sectors, so would like to know your view about that.
Well, we are hoping that the attention on health will not fade away. Because if there has been one lesson that the pandemic has given the whole world, is that unless you invest in a very efficient, equitable, and empathetic health system, which is functioning well in the steady state, even without a public health emergency, you cannot suddenly create a swift, strong, and sustained surge response when it is required. And therefore, it is important to continue to invest in health. Then there is further argument. Now, we are the largest population in the world, just having overtaken China by whatever latest data are. We have a huge demographic window of opportunity, which means that we must continue to invest in the health and skills of our people if we have to reap the economic returns. Even a health system which does invest a fair amount of money in a multi-layered, multi-skilled health workforce is a huge employment generator for young people. So even from the point of view of giving a boost to our economy through job creation, the health sector becomes very important. Particularly when we know that the advent of technology is reducing the jobs in industry, in agriculture, in service sector. The health sector actually is the biggest job growth opportunity that we have, not only for India, but potentially for the world, where well-trained young people can not only meet the needs of our health system, but they can meet the needs of the health system elsewhere in the world, where there are aging populations, unable to recruit the right number of people with the right mix of skills to serve their own health needs. So over the next 20, 30 years, we have to see India's health system as supporting India's own growth and stability, but also serving global health and global economy as well. And therefore, this budget has to actually keep that perspective in mind. And of course, given the fact that we are also hosting G20, and health is an important feature of that agenda in the immediate aftermath of the pandemic. Actually, the pandemic is not fully blown away, but nevertheless, as the pandemic starts receding, there is still attention on the pandemic preparedness and response in the G20 agenda as well. So there again, I think it will have some reflection in our budget. And of course, the election of 2024 would also have some reflection on the budget. So within that maze of priorities, I hope health will still retain its place of centrality.
Do you think it has been able to make an on-ground impact for the target population? And what kind of changes could be brought into these schemes, and how the budget could also probably push the envelope in the right direction?
Primary healthcare still doesn't have the resources that it needs. And particularly, we have seen urban health mission has not really taken off in a big way. And we also saw that during the pandemic, that it is the big cities where actually the microbes enter, they spread, and then they spread to the rural areas. And if you have a weak urban primary healthcare system, you're unable to identify cases, test them promptly, you're unable to contain through appropriate isolation and quarantine mechanisms. So all of that becomes the weak link. So you need rural primary healthcare most certainly to be better resourced, in terms of both financial resources and human resources, but urban primary healthcare also to emerge from the shadows and start becoming much more visible and effective. And while we are talking about primary healthcare, we are really trying to promote the idea of health at home or close to home. So the health and wellness centers become very important. So the full complement of staff that is required in terms of ASHAs, auxiliary nurse midwives, the mid-level healthcare providers, all of them are going to be required. Now, one of the things that we must really attend to is the fact that it's not just the original mission of NRHM with maternal and child health services, a few infectious diseases, and to some extent nutritional problems that form the agenda of NRHM, reflecting the agenda of the Millennium Development Goals. Now, with the Sustainable Development Goals and our own health policy very clearly saying we need comprehensive primary health care, non-communicable diseases like diabetes, heart diseases, cancers, chronic respiratory diseases are becoming so frequent and are a major cause for concern and a drain on income of the rural population as well. So you need to actually make your healthcare very comprehensive, including mental health problems, all of that. So the current number of ASHAs and ANMs are inadequate. We need to double their number. And that brings efficiency into the system. But at the same time, you can actually see that as a job creation opportunity as well. We require increased people at all levels of workforce. We need basic doctors, advanced skill specialists. We need basic nurses. We have specialist nurses. We need mid-level health workers. We need ANMs and ASHAs. But while many of them will take years for completing their training, like you can't produce a specialist in 6 months, you can actually train ASHAs and ANMs in a much shorter span of time. And therefore, strengthening primary health care should be a high priority for the government, and the investment should actually go into the National Health Mission for that particular purpose.
In the last 2 years, we saw that much of our energies and the government machinery went into managing the pandemic, in surveillance, in buying and distributing vaccines. Now that we are probably seeing the pandemic receding, should we plan ahead for the future pandemics that may also hit us?
No, it's not too early. We need to balance all of these priorities. Firstly, you mentioned One Health. One Health is absolutely important. We need to connect our surveillance systems across, right from wildlife to free living and captive veterinary populations and to human habitat, to make sure that whatever microbes are migrating from wild animals and coming through the veterinary population or directly into the human bodies, they can be very quickly identified. Ideally, best of course is to prevent the spillovers, and we must do our best in terms of ecological sanity to try and prevent the spillovers. But should they be happening, we need the earliest recognition so that we can both stall the spread as well as prepare ourselves with appropriate vaccines and drugs to combat it. And this is not only going to be for India. We will be seen increasingly as a resource for the rest of the world. So we do need to build that laboratory capacity and the manufacturing capacity. And R&D goes a long way into developing new drugs, new vaccines, and identifying even new methods of diagnosis. All of that is going to be important.
Does the budget also need to have some provisions for research and development in vaccines of the future or drugs? What is your opinion on that, or is it too early?
You do require a lot more R&D and investment. But I would make an additional point there. It's not just the private sector. We do need to increase our public sector capacity, because the private sector may not always find it attractive to produce certain types of drugs whose demand may not be on a very large scale, or which may not give them a large profit margin. At the same time, if you want at some point in this very competitive world to issue compulsory licenses to produce some drugs, to make use of the provisions of the Doha Declaration, then the private sector may not be ready to step up to the plate because A, they may find that this is not their priority, or B, they may be worried about multinationals chasing them to court, all kinds of problems. So we also need to build up public sector capacity by the side, while certainly assisting the private sector also to enhance their capacity. I think we should see all of them as important national assets and promote that, but the public sector cannot be cast aside. That is an important element that we must recognize.
Also, in the previous budget, sir, we have seen that there was focus on viability gap funding in trying to get the private healthcare sector to expand to tier 3 and 4 cities. What do you think? I mean, has that translated into more beds on the ground? And is viability gap funding the right approach to, address this problem?
I'm not very sure that it succeeded. We saw that during the pandemic period. Even, I mean, leave aside regular care, when they had to identify institutions which could deliver vaccines uh, in the second tier and third tier cities, towns, they could not really find the requisite public, private sector capability to deliver those vaccines. Metros, fine, but beyond the metros, what happened? So I think to depend upon the private sector alone to take up the responsibility in district level and sub-district level is going to be unrealistic expectation. We do need to strengthen our district hospitals and sub-district hospitals in the public sector, where the private sector has the appetite to get in and then enter, let them do it and they can be supported in some way. But handing it over the public health, public infrastructure entirely to private sector, I don't think is going to be very successful. But you need to connect all of them. We need all the players on the ground to play their part. We need the public sector, we need the private sector, we need the not-for-profit voluntary sector. There are a number of charitable hospitals or the not-for-profit hospitals. We must all get them in that. Similarly, even in primary care, particularly in the smaller towns, you find a number of individual private practitioners, small nursing homes. How do you bring them into the overall ambit of universal health coverage? How do you incentivize them? Unless we build a team with some degree of accountability, we are not going to succeed. You cannot depend only on public sector facilities in a mixed health system, which is evolved by default and not by design. So you have to bring whatever resources you have into play with efficiency and equity.
Talking of resources, manpower is the biggest resource. And if we look at the previous years, not much investment has gone into private sector medical colleges or nursing colleges. So, what is your opinion? You know, the pandemic laid bare the need to have more intensivists and how we do not have enough number of them. And this is not an overnight solution could be found out to this problem. So how can the budget help to carve out a long-term vision to create manpower in the country for medical professionals, both doctors and nurses, whether it's ASHA and A&M, at all levels, I mean.
Well, the 15th Finance Commission actually gave a specific directive, apart from strengthening primary care, including urban health services, apart from strengthening critical care capacity. The other element they lay strong emphasis on was training of allied health workforce. For a number of years, this was a fragmented effort because there was no council to really aggregate the various allied health professional categories into one governance framework and then guide their further development. Now, at least we have an allied health professionals council. So we ought to really focus on developing a large number of these people at different categories. And whether in the primary healthcare centers or whether in the district hospitals or in the medical college hospitals, including private hospitals, we ought to really develop this, composite cadre of allied health professionals. And that's, again, as I emphasize, not only going to serve India, but in the longer run, serve the world, because they will need many more of these people as well. So we ought to invest a lot, but which also means that we ought to insist on quality of training. We ought to be able to getting them to train in good places. We are not short of patient population, but at the same time, and for a mental health counselor or a physiotherapist, you're not short of for patient population. But you also need to invest for other categories in skill labs, simulation centers, and others. And that's the kind of investment that the budget should catalyze. Budget may not be able to give all of the money, but they should be able to catalyze by giving some incentives for investment in these areas.
And which diseases do you think um, deserve a mention in the budget? We are very bullish on our TB program, but which are the other diseases you think should have a specific budgetary allocation?
Well, our non-communicable diseases have been spoken of quite a lot, but they have not received the kind of funding they need. I mean, diabetes and hypertension are biggest threats for at the population level. Cancer, of course, is receiving attention. Mental health is now receiving greater attention. But diabetes and hypertension are things that require far greater attention than they have received. So the whole NCD program needs to be revved up and integrated well at all levels of care. There's no doubt about that.
What should be our post-pandemic policy focus areas? If we are to list three main areas the budget should definitely address, because we saw a lot of children missing out on regular vaccines. Certain public health emergencies have emerged as a result. So top three according to you.
There is a list of what are called essential public health services. And they include surveillance, etc., but they also include things like immunization. So all of them should be supported without interruption, even when challenged with a public health emergency. And we ought to be able to build those buffers very clearly. So that's going to be an absolute priority. If you look at what's happening in terms of even the G20 agenda, the three priorities that have been identified are pandemic prevention, preparedness, and response, which is fine, which sort of fits in. But it's not just the pandemic. Covering all infectious diseases is going to be an important element in that, including TB, of course. So the second element is the whole idea of getting universal health coverage advance further. And there, I think recently there has been some media report that the Ayushman Bharat beneficiaries under the Pradhan Mantri Jan Arogya Yojana, PMJ, will be increased from 40% by an additional 12% or some 12.5% or something like that. So progressively, and also bringing the central government health service into the Ayushman Bharat. The idea of progressively unifying all our insurance programs, health insurance programs, into a single payer system is going to be an important element. And how do you build the architecture of that? But universal health coverage can only be delivered if you make it really affordable. So providing greater financial protection and especially providing coverage for outpatient services and drugs, which is not a part of PMJ at the moment. So unless you link up primary health care and Pradhan Mantri Jan Arogya Yojana, the comprehensive primary health care and Pradhan Mantri Jan Arogya Yojana should be linked up in such a manner that outpatient care and free medicines are also available, not just providing service at the time of hospitalization. And that requires a certain degree of not only administrative governance changes, but also more investment into the process.
Thank you so much, sir. It's always a pleasure talking to you. So many takeaways from this conversation. And thanks once again for taking out time.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.